Good evening. Welcome. Thank you all for joining us. I am Nicole Nifo, and I'm here joined by my amazing business partner, Michelle Francis Smith.
Hello.
And we are from Perinatal Massage Therapy Education. We are here every Thursday at 8:30 p.m. Eastern Standard Time, talking to you about anything perinatal related, anything perinatal massage related. That's definitely our focus in our conversations. It could be about your business. It could be about your patients. Mm-hmm. Sometimes we have people we interview. We love when you can join us every week and share your experiences and ask your questions. If you want to know when we're live, you can follow us on our Facebook page, Perinatal Massage Therapy Education, and make sure that you hit the follow button, because then you'll get notifications as soon as we go live.
Yes.
So, how are you doing, Michelle?
I'm doing pretty well. A little tired, busy week. Busy week, busy day.
Halloween was yesterday.
So I was out with my three and then a good friend of ours, my husband, and that friend's daughter. Mm-hmm. So we did some cruising around the neighborhood. I'm happy it was nicer weather this year for the first time in about.
It was amazing. I saw a bunch of crowds of people come by my house yesterday, and parents kind of had their little travelers with her, whether it was coffee or alcohol. I have no idea. But I thought, how smart is that? We didn't do that this year because it was our first year in our new house. And so we wanted to do the whole spooky Halloween thing, and we did. It was very scary. And a little boy walked by and said, "I don't like this house. It's too scary. I like normal houses." And I said, "It's all pretend." We had the projector on our bay window and made it look like, hands were trying to crawl out. It's pretty scary. But next year, I'm going to get one of my other family members to come over and hand out candy. And I want to join other people to walking around the neighborhood, because I think it was such a nice evening to do that.
Yeah, it's kind of a mixed thing, right? Like you're heading out, but then you're missing out.
Yeah.
Being out with people and seeing your neighbors. Like it's always fun to go out and see my neighbors, people who've been in this community. We've been in this community for 8 years.
Yeah, that's nice.
Communities, so it's really nice.
Did you dress up?
I did. I was a bunny.
Oh, cute. Did you wear anything at work?
I just wore orange pants.
Okay. Nice.
Orange when I treat.
Yeah.
And when I'm out with the kids, I dress up in something. So I had my fingers and little bows.
Oh, that's nice.
Yeah.
I was a witch and I had a black wig. But at work, actually, I had bought this headband last year, and it has like a little witch hat on it with like witch legs. I think it was from Pure One or something. Anyways, I come into work and like everybody at work's wearing headbands with like little things hanging out of them. And I'm like, I guess when you're in the manual therapy world, you can't really dress up. Like it's hard to treat patients all day when you're dressed up like that. Yeah.
Exactly.
So yeah, I upgraded my outfit, and a girl came by our house, and she was like probably, 14 or something. She goes, "Love the outfit. Very on point with the theme and also stylish." I was like, "Well, thank you."
Oh, thank you. When you get a thumbs up, or when you get 2 thumbs up from them, then you know you're cool.
I know. So funny.
Totally.
Anyways, still waiting for more people to join us, but maybe we'll just get started, and then if you guys miss anything, then you can just replay our Facebook Live.
That's right.
So today we're coming to you to talk about working with patients who have had postpartum complications due to childbirth. So Michelle and I have a lot of experience working with patients in postpartum. So we're going to share a little bit about our clinical practice experience, but also when we're teaching, we talk a lot about this topic because although it's more spoken about now in 2018, all of these issues that can happen in postpartum, it's still not something that a lot of therapists are promoting to their patients. That if they do experience these things and they need to come in for to see their massage therapist, a lot of times patients are just being told to see a pelvic physio or the focus is not even on the patient and they're kind of suffering in silence and taking care of their baby, which I can understand.
Right.
But I think it's really important to get this conversation going and let your patients know that you are there to help in postpartum. And let's talk about some of these things that that can happen. So first, let's talk about cesarean scar healing. And how sometimes it can heal very poorly because some patients are not resting, and they'll get some gaping happening in the scar, in the tissue. They'll get an infection. I'm on a lot of forums on Facebook for mom groups and also people who've had cesareans, and it's so common to see a couple times a week people saying, there's this like weird oozing or color or smell. And these are not health practitioners. So these are just everyday people not understanding what even maybe an infection looks like. And they don't understand why it's doing that. But they want to clean their house, or they have another kid to take care of, or they're trying to figure out how I'm going to make dinner. And you're like, how many days postpartum are you? Like you're less than a week postpartum after a major surgery, and you're not resting.
And so, of course, like what is going to happen? The body's going to respond.
Yeah.
So you've had a major incision. There's so many layers to heal.
Yeah.
They're just looking at the outside and they're thinking, well, it looks, the staples or stitches or whatever. I have gauze over there. It's good. No, it's really supposed to be about focusing on that healing and rest time. And as I think it's great that you mentioned, sometimes people aren't in a position to rest. They have other children to take care of, or other responsibilities. They're not in this, or don't have support, right? Don't have family around to be able to help take care of those things. Like this is all part of it.
Yeah. I think it's something that people don't always plan for, especially if, it's an emergency cesarean. Sometimes people think with vaginal delivery that it's such a natural thing to happen to the body that they don't need the help. But really, I think for anyone delivering a baby, they need to have some sort of plan where they do have people coming and checking in on them, or helping to take care of that if they have multiple children at home, especially young kids. There's no way after you've delivered a baby, either vaginally or cesarean, that you're going to be able to run after your 2-year-olds that first week. You should not be. You should be resting on pelvic rest. You've literally just had a baby. You grew a human being inside of you. And I think people treat it as if they've just gone to get their nails done. Oh yeah, I had a baby. And really it's there's so much healing that has to happen from within that our patients don't realize. We need to paint that picture for them that they need to rest. And I know everything sounds great saying, oh, you need to rest. No, this is why. And explain to them how important it is. I think another thing with cesarean delivery is that you're not getting the doctors giving any kind of postpartum treatment plan to the patients. It's pretty much, check them before they leave the hospital after a day or 2 or 3, and I'll see you in 6 to 8 weeks, right? It's not, what people are getting when they have knee surgery or shoulder surgery. There's not that kind of follow-up. There's no plan to see physiotherapists after. There's no plan to help them make sure they have that functionality. This is a major part of their body. It's across their lower part of their torso, in their pelvic area, where they have this huge incision and multiple layers of tissue and organ that have been cut through. And yet there's no plan for that patient. So yes, of course, for an everyday person who doesn't understand the body, when they see this scar looks like it's closing, let's just get up and do, keep going back to our regular activities. Maybe I'm on my pain meds. Maybe, I'm used to the pain and discomfort from moving around. So, that's common, right? We get used to it being sore, that we don't use pain as our guide to stop us. We're thinking, oh, I just had a baby, or I just had surgery, that, it's just something I'm used to. So I just think we've got to look at all of those factors. And really, I find as massage therapists, we can advocate for our patients in ways that they don't realize that they should be advocating for themselves.
For sure. And I think something you're touching on or kind of pointing to is the communication around
Yeah.
all of this.
Yeah.
So, because birth is considered something that many people do,
Mm-hmm.
even though not everybody can,
Yeah.
um, but because it's something that's common, right? Having
Yes.
babies is common. I think it gets minimized. And then even how we talk about our bodies or even refer to other people's bodies gets minimized as well. And I see our role in part just creating an environment where the language we're using is really neutral.
Mm-hmm.
So you can get really caught up in the whole excitement of birth.
Yeah.
People have a plan. Their plan might be to have a vaginal delivery. Their plan might be to birth at home. Their plan might be all these things. And if that happens, okay. And if that doesn't happen, okay.
Yeah.
But our patient isn't going to be neutral. They're going to have highs and lows because they're attached to the birth plan that they created. And I find the biggest challenge is to not get pulled into that, be supportive in a neutral
Mm-hmm.
way. So
Yeah.
not overly excited because the vaginal delivery that you wanted happened and it was only 2 hours.
Yeah.
Because then what happens when their next baby comes and it's a 36-hour labor and it happens to be a surgical delivery and, then how is that going to seem genuine when you're like, oh, that's okay. When you were like, yeah, go get them. That was great.
Yeah. Yeah.
Mm-hmm.
It's like you have this expectation of what it should be like, maybe for yourself or what you experienced, or if you don't haven't experienced birth yourself, you have this expectation of the way it should be. So you're congratulating people when it should be that way. But then, what happens if it's not that way? Then they're going to think they let you down, they let themselves down. It's not right. Hi, Elizabeth.
Hello. Good evening.
So I think that's great to bring that up because communication is key. And I know you and I always talk about that when we're working with other therapists, that sometimes it's the simplest thing, the way we say something or the tone that we have when we're speaking about childbirth or pregnancy or in postpartum, that, can really set the tone for that patient and either make them feel really comfortable and trust you or not. I know a lot of my patients have a very difficult time with breastfeeding, and it's not, and I didn't. That was probably the only thing I didn't have difficulty with in my postpartum after my cesarean. And but I don't tell people that. I don't tell my patients that, right? I don't say, oh, it's so easy. Like, it wasn't easy. It took like 7 days for mine to come in. I was very stressed out. But I know people have issues with latch and all this stuff. And that's not something I share because I know they have a hard time. And I just sympathize and say, it's a journey, and like, these are resources I can give you. And, you need to do what's right for you and support the patient, because everyone around that patient's giving them opinions about how they should be doing things when it's their body and their baby. And they need to be putting in all that work and be motivated to be doing it if they're going to do it. Right. So I think it's important really to really watch kind of how we're engaging with our patients about these topics, and just be there to listen. Sometimes they just need someone to listen. Let's go into the second one, episiotomy, healing, and pain. You were saying that often Michelle works, we've talked about this before, Michelle works at a pelvic physio clinic, and the patients that they see there, they're noticing that there's a lot of episiotomies that are cut to the one side more than the other. You were saying the cut maybe more to the right side.
Yeah, so just, I guess probably over this last year, in seeing so many more patients who openly talk about their episiotomy and co-treating them with the pelvic physios, what is coming up in conversation is that often there is, especially in more of the severe episiotomies, incisions, there tends to be more of a one direction cut, and it seems to be often to the right. We wonder if this has to do with the dominant hand, maybe if some of the doctors happen to be right-handed or something, if there's something about that. Often when something's done in an emergency, it's done very quickly. So that's another thing. And with that, we were noticing, and I was noticing in treatment, a lot more issues with their right adductors. And sometimes they're having like a lot more perineum, labial pain on the right side. And then consequently, a lot more high density and tone in the left gluteals, almost as a way of like counterbalancing cross syndrome.
Yeah.
And so then we'd be having this like left hip hike glute pain, and then like adductor really fatigued, tender, and then sometimes a lot of labial pain. And so just in being able to have these many conversations with patients, which is the most I've ever had in my practice, you start to see these trends. And it's interesting. It's really informing kind of the choices that I'm making as a therapist.
Yes.
And starting to have a bit of a template. It's created a bit of a template. And then I try it with different patients who've had similar birth experiences, and I'm noticing similar improvements, which is kind of cool to see.
Something that I've experienced with patients who've had episiotomies, and especially I have this one in mind recently that she'd come in and she was in so much pain postpartum. And, people think, oh yeah, vaginal delivery, like you didn't have a cesarean. So, you know what I mean? Like you're totally fine. When she had the extended long, pushing phase, and, she had the episiotomy, which they're cutting multiple layers. It's not like they're letting it just tear naturally, where it may just be like first couple of layers that have torn. It's like multiple layers. So it's almost like a mini surgery through that part of their genitals, and it's painful, and it's an area where they're sitting on, right? And so, this patient in particular, no one had really informed her about what they had done. I think she knew that she did have a bit of a incision, but she didn't know to what degree, and she didn't know why she was in so much pain. Like she just wasn't given that information. And it was like not until she, interacted with another health practitioner, like a nurse in the hospital, that was like, well, of course you're in pain, like
you had all
this happen to you. And she's going, what? I didn't know any of that. I was like, I think it was probably her first baby too. And she was just like, what is all this, And so I think, a lot of times when you have different practitioners talking about postpartum and symptoms and stuff, like they like to joke around. It's like this shit no one tells you, right? When it comes to prolapse or incontinence or pain and, with intercourse, or pain after having vaginal delivery, or any of those things that, everyday people don't know about because they're not health practitioners. They haven't studied this stuff. They just know about being pregnant and getting their baby room ready and what they're going to name their kid, and if they're going to be in a religious ceremony for their child. Like it's not about oh, okay, yeah, I have to get diapers, like I heard about that myself for postpartum, or I got to bring my slippers, or what to pack in my bag. It's not like this is how you prepare your perineum. This is how you can help heal your perineum after, or any of that. Yes. And so you have to remember that as massage therapists, as health practitioners, that a lot of these patients just don't know. And there's so much information out there that a lot of patients end up just, shutting off their brain to that information overload when they're pregnant. So for you as a trusted source who can give them that information in a way that they'll understand, give them the information in a timely manner. I mean, if they're 13 weeks, don't start telling them about prolapse.
Right.
Prepare them along the way in a way that's not going to scare them. You know what I mean? But give them the information, because I think if you don't, then they won't know to come back to see you for, like you were saying, that patient with all that right-sided tenderness and pain, the left side compensating. Some people think this is just normal and they just live with it, right?
That's right. Most people think that, yes.
So I think it's important as a massage therapist, again, inform your patients, give them those tools that they can use to help heal themselves. And one of them being that they should come in and see you postpartum for a checkup for themselves, right?
Yes, absolutely.
If any of you watching have any comments to share about working with patients in postpartum after childbirth, you've had any experiences you want to share, please share below. Michelle and I will stop and take a look and comment as we move along. And the last one we want to talk about is prolapse. That's associated with like a long labor, sometimes 24 hours or more. a long pushing phase that's usually over 2 hours. So what's your experience working with patients who have prolapse? Do they know they have prolapse when they're coming to see you? Do they, so have they had that diagnosis yet? Do they come in kind of with symptoms, not knowing what is going on with their body? Are they postpartum in the first 6 to 8 weeks? Are they 6 months? Are they a year postpartum? What's your experience there?
Okay, so in the environment that I'm in, and just letting people, especially new viewers, know I'm working with pelvic physiotherapists, and they're referring their patients to me, and we're co-treating. So everyone who I have seen, it wasn't determined like from anything in our treatments. They came knowing.
Right.
And most of the time they came knowing like what kind of degree of prolapse they have. They knew exactly which prolapse they had, you know. And they had an idea of symptoms, and they also had an idea of how to measure when it was improving, because they had already had internal assessments, already had started some sort of exercise program, whether it was strengthening or releasing certain things. So by that time, I'm getting to treat the external structures and getting a sense of, okay, what's the tone like here? What's the strength like here? What's the weakness level here? What are the trigger points? Where are they? And then getting to monitor them as they're getting both massage and physio.
That's great. And so for a massage therapist who's not in a pelvic physio clinic, something I have experienced in my practice, I do have a lot of pelvic physios in the community that refer to me, which is really great because then I already have a full picture. In my work, I can just go right into my work so much easier instead of trying to figure things out. But I do have patients that have come to see me, and I'm treating them in postpartum, and we're talking about symptoms and me, you know, bringing these topics up in a gentle way, and them saying, I think I have prolapse. Well, I think I have those symptoms. And then saying, okay, here's the pelvic physio's card, go get checked out. I've had midwives do that, you know, having their own babies and having these different symptoms, and saying, you need to go get checked out. I've had first-time moms do that, where it's like, you know, they're pregnant with their seconds, and I'm listing a symptom of when you get the bladder prolapse and you have to lean forward to continue to empty your bladder after you feel like you've already urinated. And then saying, oh, I think I have that.
Right.
I'm going in to see pelvic physio. And, you know, I've had patients come in and I'm treating breast. I'm doing, you know, post-mastitis treatments on their breast and talking about pelvic health again, bringing these different topics up, and them saying, yeah, I think I have those symptoms, and then going to get checked out, and they do have prolapse. So I think it's really important to have a list of the symptoms of prolapse, especially the common ones, just to kind of share that with your patient, that if they do experience these symptoms, definitely a good sign to go get checked out. I have one patient that was in yesterday. She's 7 months postpartum now, and she has a pessary. And so that's commonly used in patients who obviously have prolapse to kind of help hold everything in there. And she says she takes it out, you know, to clean it, and she takes it out to kind of give herself a break and everything. But she hadn't been back to see the pelvic physio since she had the diagnosis in the first couple of months postpartum, and has just been kind of using it like she was at the beginning of postpartum. But now she's 7 months, and she said, you know, I ran to the mailbox the other day, and I ran back, and I literally lost my bladder control, and I peed my pants, like literally just had no control over it. She had no control over the sphincter. And she's like, I don't know what's up with that. I called the pelvic physio and made an appointment, so I'm going to see them again. I was like, had you been back
since that original?
And she said no. And this is something that's common that my pelvic physio friends tell me in the community. And I'm like, oh, okay, I'm treating so-and-so. And they're like, yeah, they haven't been back to see me. And I said, I will reinstate that they need to go back for a follow-up with you.
And continued treatment, right?
Yeah.
As well.
They go in and they get the diagnosis and they think, okay, I'm doing treatment, but then they kind of, something else takes over. Yes. Right? And then they forget.
Like a new baby.
Yeah. And they forget to read books. So then I'm there kind of advocating that, okay, you need to go back. You need to go back. And usually it works, right? Which is great. Physios are like, they need to come back. But with this patient in specifically, she is a health practitioner herself. And I was telling her, I said, your body was so different at 3 months postpartum.
Then it is.
Or maybe it was 2 months postpartum she had gone. And now you're 7 months postpartum. It's totally different than what it was back then. And you're still using the same treatment tool to help you when really you should have gone through some sort of progression already. So I wouldn't be surprised if using that pessary has caused a different complication, or it's just a sign that you need to move to that next level.
To the next level, right. Yeah.
Or it's inhibiting or something, right? Like just whole loss of bladder control. I was like, yeah, no, that wasn't even like a pressure causing incontinence. You know what I mean? When you're sneezing and coughing.
This is just
whole loss of control. So it was quite, I love hearing these stories. I mean, I don't like hearing my patients suffering through anything, but I love hearing these different stories and kind of helping patients to piece things together. And if you look at the research, the first degree of prolapse is very common in patients who've had vaginal delivery because they've pushed a baby out. And especially the way that the doctors get people to push nowadays is on your back, doing that Valsalva, which we all know is not okay for our pelvic floors. And so I believe that it's very common to have at least that first degree. And then after, 6 to 8 weeks, it should start to come back a little bit. But it's when your patients are getting that, kind of normal, descent of the cervix, but then not resting and not not getting that pelvic rest enough and not practicing those self-care techniques to kind of bring that awareness back to their pelvic floor, like the core breathing and kind of doing that engaging of the pelvic floor with the piston, right? I think it's really important that our patients have that awareness of that area. Especially if they've experienced any kind of tearing or episiotomy. We're not expecting them to go and be able to pick up blueberries with their labia, but definitely having that awareness down there of what the tissue feels like and being able to just rest.
Right.
Being able to
I really was happy that you were talking about how you integrate while you're treating someone postpartum, these conversations, and you use the word gently, but the fact is you have them. Let's not rely on what's on our standard health history form as a means of getting this information, because you won't. It's not on our standard health history form, and unless you're creating a form, and even that, I think just human conversation while you're in treatment is going to bring out a lot more, because a patient of ours might not think that we could do anything to support anything related to the pelvic floor. So they might be seeing these questions and thinking, I'm just going to skip over that because my midwife already knows. Or my obstetrician already knows.
Or they're not reading it. They're literally skimming and they're just like, hey, let's have my treatment now.
Right. So there's just so much more that comes from being with people and just talking to them where they're at. I think that's really important. I'm glad you mentioned it.
Something that made me feel so amazing as a massage therapist and so proud of our profession and being able to call myself a massage therapist. The other day when I was working with my patient and I was talking to her, she has a breast abscess that was a mastitis and became abscess, had it drained. And I did breast treatment with her, and she reported back this week saying that it felt a lot softer, which it was. I palpated and I treated again. And she was actually able to produce more milk out of that breast.
Great.
Which is so awesome. And we also talked about incorporating her scar treatment because it's her second baby and she ended up having a cesarean. And I said, why don't we do both of them in a treatment? Why don't we treat your scar and your breast? But just explaining things to her and talking to her about her breast and how she can be doing breast treatment and not just like the doctor says, do massage. What the mom does is digs into her breast tissue. And I've talked to so many patients about this, even my midwifery friends who've had babies, and they're like, oh yeah, whenever I have, blocked ducts, I just dig at it. And I'm like, it's not a muscle.
Please don't dig at it.
And the thing is, it probably irritates it more, right? And so re-educating her on her
Course.
body, on how to touch her body was so big. And she said, it's so nice to finally have someone who knows what they're talking about.
Yeah.
And I was so proud that I'm like, yes, and I'm an RMT, you know? I felt so good about that because, you know, I always hear every day that, you know, therapists are burning out or they're leaving the profession to go do something else like osteopathy, which I think is amazing. But, you know, I'm a diehard massage therapist and I'll always be a massage therapist. I may take other trainings, fine, but I will always be an RMT. And I'm so proud to be a massage therapist because there's so much we can do. People, other therapists, I feel like don't realize that there's so much they can do within their scope of practice with their patients, and how many conditions we can actually improve, especially when we work as a team. And so, you know, on that note, I love being an RMT, and I think that working with your patients in postpartum, you know, treatment planning in postpartum with your patient, you've said it before, when they're pregnant, get them to book an appointment for postpartum. You know, if they have to cancel it or they want to bring the baby to have a treatment instead, or they are coming for sure, at least they know they have that. It's not last minute, you know, weeks after saying, oh, can I get in to see you now? And you're saying, well, it's December and I'm already booked up for the month, right?
Right, exactly.
Because it's Christmas, you know? So definitely treatment plan with your patients for postpartum, and don't discount what you can do as a therapist to help your patient with prolapse, with incontinence, with who's experienced episiotomy and has pain, patients who've had cesareans, any of this.
That's right. And just remembering that communication is actually the way in. It's not just about having a skill set, because if you can't actually discuss any of this, if you don't feel comfortable to discuss any of this, it doesn't create an environment where you can actually offer these amazing services as part of your RMT practice.
And if you're not comfortable right away talking to your patients about this part of their body, then practice on a colleague or take a course in this topic. We offer this, obviously. And, you know, just get some mentoring in that.
Our group.
And get in our group.
You know, if you aren't on a Facebook group, please join it, the Pregnancy Massage Therapists Canada. You know, search anything postpartum. You'll see lots of threads and conversations we've had. You know, reach out to Nicole or I individually. You know, through our page, you can send us a message. We'll answer you. You can email us. Yeah, there's lots of ways to get support, but don't feel like if you don't have that confidence or the strength behind you because you don't have a lot of experience that you can't actually start building it like today.
It's so true. And as Michelle always says, I always quote you. As Michelle always says, they don't know what they don't know.
What you don't know. And of course, I quoted someone else, you know, one of my mentors.
Yeah. So I think that on that note, we're going to close up for the evening. Thank you all for joining us. And if you're watching the replay, thank you again for watching. Please share this with your colleagues and your network. We're live every Thursday at 8:30 Eastern Standard Time. And if you have questions that you want to ask us ahead of time, send us a message. We are always going to post our topic during the day on Thursday. So if you see that and you're like, oh, I have a question, but I can't attend live, but I want you to answer it. So send us the question, we'll answer it, and then you can watch a replay. There you go. No excuse not to join us, right?
That's right.
Well,
okay, everyone recovered from last night.
Yes, no more chocolate. Well, I know you haven't had any, but
I haven't. This is the first Halloween that I haven't.
I'm on a chocolate strike, so.
I went on the strike before I put one in my mouth because once I start.
Exactly. Yeah, that was me. I'm like, why did I choose to hand out candy? I don't know why.
All right, everyone.
I hope you have a great evening, Michelle. We'll talk soon.
You too. Okay. Bye.